Welcome to yet another edition of the Ministry of Health's Weekend Review. And here is what we've been up to. On June 26, Minister of Health Dr. Frank Anthony and Minister of Local Government and Regional Development Sonia Parag met with regional health officers to discuss health-related challenges in the regions. Together, the senior government officials and health officers deliberated and discussed methods for implementation within the regions to aid in better delivery of healthcare services. Thereafter, Dr. Anthony attended the launch of the Safeguarding the Human Dignity and Rights of At-Risk Populations in Vulnerable Communities across Guyana. The SPAR project, funded by Global Affairs Canada and the International Development and Relief Foundation, aims to improve mental health services and reduce stigma for individuals, thereby enhancing dignity and mental well-being. In his keynote address, the health minister emphasized the need for greater education on suicide factors and prevention strategies. He highlighted that the unrecognized depression can play a crucial role in mental health issues.
And we are very happy that they're actually reaching out and going to every region and training people. This particular program with gatekeepers is very significant. We want people to know more about things like suicide and the factors and the ways that we can prevent it. We want people to understand a little bit more about anxiety. All of us from time to time, we do have anxieties, but we don't perhaps recognize it as an issue. We feel we can cope, but sometimes people can't cope very well with anxiety. We also recognize that depression plays a very important role, and if we don't understand the signs and symptoms of depression, some of that can lead to suicide.
Meanwhile, on July 3rd at the Ministry of Health's boardroom, the Minister of Health received a donation of promotional items from Breakthrough Action. This donation aims to support the Ministry of Health's campaign to encourage the uptake of HPV and COVID-19 vaccines and to bolster the general immunization campaign. During the handing over ceremony, Honorable Dr. Frank Anthony noted that one of the essential steps to encourage individuals to take the HPV vaccine is to address the myths surrounding it. Thereafter, Honorable Dr. Frank Anthony accepted a donation of IT equipment from UNICEF for the Maternal and Child Health Department. This donation will be given to the Central Vaccine Bond to support immunization through vaccine stock management and reporting, as well as to boost the surveillance capacity for the immunization program. Dr. Anthony highlighted that the ministry is undertaking an electronic health record system initiative with appropriate software development expected by the end of 2025. On the said day, the Ministry of Health's Drug Demand Reduction Unit held a formal ceremony to raise awareness and emphasize the importance of a comprehensive approach to combating the drug situation in Guyana. The event recognized under the theme, "The Evidence is Clear, Invest in Prevention," aimed to strengthen actions and cooperation towards achieving a world free of drug use. In his remarks, Honorable Dr. Frank Anthony, Minister of Health, highlighted that the comprehensive approach offered by the ministry and its partners provides an alternative path for individuals caught in substance abuse to receive treatment and rehabilitation.
We recognize this to be an issue, and we want to make sure that people who we find that have substance abuse, that have been abusing substances, that we are able to provide them with clinical treatment in the cases where they have them, and to offer them different solutions.
Before we conclude this week's review, we want to encourage you to take advantage of the government's eye testing and spectacles program. Anyone under 18 years of age and senior citizens is eligible for a voucher valued at 2,000 Guyana dollars and a second voucher valued at 15,000 Guyana dollars. should he or she require spectacles. So, get your eyes tested today. Until next time, do take care.